Well, firstly, thank you to David and Justine and to Marg for inviting me to this event on access to insulin. And I share Justine's enthusiasm for the fact that World Health Day is now focused on diabetes this year, which from an NCD Alliance and from an NCD perspective is brilliant. And it's great to see so much media coverage on the world, on the Global Diabetes Report that came out yesterday. So in terms of my reflections on the findings that David presented, obviously, being from the NCD Alliance, we see these issues from, I guess, a couple of different perspectives, from obviously our advocacy with member states, so from a kind of political standpoint, but also as we're an alliance of 2,000 organisations in 170 countries, obviously many of our organisations in our network are very much at the forefront, very much the foot soldiers of improving access to medicines. Secondly, I'm coming at it from a broader NCD perspective. Obviously, as the NCD Alliance, we focus on NCD issues. So I'm coming at it from a slightly broader non-communicable disease perspective, perhaps. So in my short 3 minutes, I wanted to kind of take a step back and really look at access from a broader standpoint, really looking at the kind of broader enabling environment to improving access to insulin, but also to broader NCD medicines and technologies. And I want to look at it from 3 specific perspectives, from the political perspective, the health systems perspective, and then from the community perspective, because all 3 of them are obviously instrumental in improving access. So firstly, from the political perspective, one can say that we've made significant strides in getting diabetes and NCDs onto the political agenda. You can see that from the global NCD targets that were adopted a couple of years ago by governments. I'm sure many of you in the room are involved in those negotiations. And obviously that 80% target on essential medicines and technologies was adopted by all governments of the world, which was a fantastic step forward. Moved to a couple of years later, now we've got NCDs firmly in the Sustainable Development Goals and diabetes within that, obviously, firmly in the development agenda, which again is an important step forward. Before, diabetes and NCDs were not seen as a development issue, and now they're very much centre stage of the development agenda, albeit an extremely complex agenda of 17 goals and 169 targets. And the other important part from the political perspective, and David mentioned this in his presentation, is that there's so much more focus on universal health coverage, which is really an opportunity that we in the diabetes and NCD community can be leveraging. So many more governments now are embarking on pathways towards achieving universal health coverage. And from a civil society perspective, our ambition is to make sure that they are including diabetes and obviously access to insulin in those essential packages that they're rolling out. But from a political perspective, even though you can say that progress has been made at the global level, what we're really seeing is a lack of translation of those global commitments down to national action. And so governments are meant to be developing national NCD plans by 2015, and we know that only 50% of countries around the world have national NCD plans, which is so fundamental. Secondly, in terms of financing, we can see that financing is an absolute major issue in NCDs, and it very much impacts upon access to essential medicines and technologies. And within financing, we really need to focus on domestic resource mobilisation. I think I'm way over time, so I'm going to skip on to health system strengthening. Just to say here that from a health systems perspective, I think it's so important when we're talking about access to think about systemic approaches to improving access. And what I mean by that is really trying to reorient the whole health system to address NCDs and chronic conditions, which is so different from when you're talking about a health system addressing infectious diseases. And within health systems, health workforce is essential. It's all very well and good to be improving availability of insulin in a certain country, but do we have the workforce behind that, particularly diabetes educators, to make sure that adherence is there as well? And then thirdly, community. Community is absolutely essential. You might think I'm slightly biased coming from a civil society perspective, but the role of civil society improving access has been proved throughout many different health issues. The civil society community, the civil society movement for NCDs is very different from the HIV/AIDS movement, and we can't pretend to be coming from similar roots. We've got to recognise that there's huge differences. However, there's a lot to learn from the HIV/AIDS movement. And I think having Crystal on this panel is one example of where we need to learn from the HIV/AIDS movement, putting the patient voice front and centre, which will then increase and build the demand for insulin and for other essential medicine techs.